Welcome to the Inferior STEMI education section for the month of February 2023, the SSM EMS education. What is an inferior MI or ST segment of elevation? This occurs usually when there's an occlusion of the right coronary artery, and this happens in about 80% of patients. This is also less commonly occurring in the left circumflex artery, causing an infarction of the inferior wall of the heart in 18% of patients. So if you look at this picture of the right coronary artery on this slide, you can see there's a small clot where the white is in the middle of the right coronary artery. So that's a big indicator of an inferior ST elevation. The causes of an inferior STEMI are smoking, hypertension or high blood pressure, high cholesterol, a sedentary lifestyle, people who aren't very active, they're obese, diabetics, coronary artery disease, people with a family history of heart complications, and people that use drugs, especially stimulants, can cause inferior STEMIs. The signs and symptoms of inferior STEMIs are chest pain. A big one is nausea, vomiting, and diaphoresis. When you look at a patient, most often when I see a patient that looks like they're really diaphoretic and they have nausea and vomiting, I'm like, oh, this is inferior or it's right coronary artery. Shortness of breath is a big symptom, fatigue, lightheadedness, a heaviness or pressure in the chest, bradycardia, and heart blocks. Really pay attention to heart blocks. When you see a heart block, it could most definitely be an inferior STEMI. Okay, let's talk about treatments for inferior MI patients. So let's start off with giving IV fluids. So this is a big deal because when you have a right ventricular infarction, you really want to give IV fluids so you can help maintain cardiac output, blood pressures, and coronary artery filling pressure. And this goes hand in hand why you want to use caution with nitro, because since this patient with an inferior MI is at a higher risk for developing hypotension, nitroglycerin dilates the artery and causes the blood pressure to drop. So when the patient gets to the cardiac cath lab, ways that we treat inferior STEMIs are clot-busting medications. Those are Angiomax and Aggrastat. We use balloons to open the artery. We also use a device, a couple different devices. One is Pronto and one is Penumbra, and those are clot retrieval systems. So basically what they do, they get the device into the artery next to the clot, and it sucks the clot out of the artery. We also use stents to open up the artery as well. What leads on an EKG demonstrate inferior STEMI? So if you look at this EKG here, if you start on the left-hand side here, you look where we have ST depression, we have ST elevation. So you can see ST elevation and leads 2, 3, and AVF. And you can see reciprocal ST depression and leads 1, AVL, B5, and B6. Case study 1. So take a look at this EKG. What do you see? You see ST depression. Do you see ST elevation? And what leads do you see those in? Do you see elevation in AVF, 2, 3, depression, lead 5, 6, AVL. This, in fact, is an inferior wall MI. This patient called EMS with severe chest pain and shortness of breath. He has a history of coronary artery disease, previous MI, and previous stents. So EMS activated the code MI from the field, and he was brought to the hospital, and a bare metal stent was placed to his right coronary artery, and he was brought back to the cardiac cath lab the following day for a laser atherectomy in his circumflex and a drug-eluting stent in the right coronary artery. So when we talked about inferior STEMIs and where they occur, this patient actually had blockages in both right coronary artery and circumflex artery. Case study 2. This patient called EMS with chest pain. An EKG was performed, which showed an inferior STEMI. A code MI was activated from the field. So let's look at this EKG. We talked about the leads and where elevation and depression are located when you have an inferior STEMI. So let's look at lead 3. You can see ST elevation. Look at lead AVF. There's a ST elevation. Lead 2, ST elevation. If you take a further look, you can see ST depression and AVL, ST depression, and lead 1. So it's really important that you keep an eye on patients with inferior STEMIs and you give fluids. When this patient arrived to our ER, they were in cardiogenic shock. They had recurrent VTAC and VFib arrest. CPR was performed, and then he was transferred to the cardiac cath lab where we performed an intervention. We removed clot from the right coronary artery, and we ballooned and placed one drug-eluting stent. Case study number 3. So we're all pros by now, right? So let's take a moment and study this EKG. Check out the leads. Do you see depression, elevation, PVCs? What do you think? So in this EKG, you can actually see a right middle branch block, and you can see an inferior STEMI. Do you see where that's located? You see a wide QRS complex. You see elevation. So this patient called EMS for chest pain. The EKG showed inferior STEMI. We talked about risk factors. This patient's risk factors included hypertension, high cholesterol, gout, GERD, morbid obesity, prediabetes, and a former smoker. When this patient got to the ED, he VFib arrested. CPR was performed. He was shocked. ROSC was obtained. We gave epi amiodarone bolus. Then he was transported to the cath lab for an intervention. So if we look at the pictures on the right, you can see the right coronary artery in the beginning was full of clot. So we used the clot retrieval system to remove clot. We used laser, balloon, and placed a drug-eluting stent. We also placed a temporary pacemaker. He actually arrested multiple times during the procedure and was defibrillated multiple times and recovered and did well. The next morning I was actually in his room talking to him, and he sat up the side of the bed like nothing had happened. Thank you so much for taking the time to learn about inferior STEMIs. From this PowerPoint, hopefully you have learned about signs and symptoms, treatments, and what leads to look at. So remember, leads 2, 3, AVF. Those are the big indicators. Look for heart blocks, look for nausea, vomiting, diaphoresis. All those are good indicators of inferior STEMI. Please come back for March education. We're talking about 15 lead ECG STEMI criteria and critical 10 goals. Bye.